This part of the toxicologic investigation section is focused on the toxin iron. Let's start with our case. This is a 14-year-old girl that was brought into a northern nursing station by her mother. Her mother saw an online posting by her daughter that stated she was going to commit suicide. When she found her daughter in her room, she had been vomiting all night and admitted to taking a bottle of iron pills. Think about the types of questions that should be asked to help assess the risk of this ingestion to our patient, and what tests should be ordered now. There are a few key questions that will help to determine the risk of this ingestion to our patient. These include the type and amount of iron ingested, the time since the ingestion, and an assessment of when her symptoms started following the ingestion. Not all iron formulations are the same. There are multiple types of iron formulations on the market, including tablets, liquid, and chewable or gummy candy-like preparations for children. Iron is also a common component of multivitamins and prenatal vitamins. The ingestion of iron salts is associated with high mortality, and it is important to have an accurate assessment about the elemental iron content of a product. For example, ferrous gluconate contains 12% elemental iron. Ferrous sulfate contains 20%, and ferrous fumarate contains 33%. Time of ingestion is important for several reasons, including making an assessment of time to onset of symptoms. Depending on the iron formulation, symptoms will develop within 1 to 4 hours post-ingestion. Asymptomatic patients are unlikely to develop symptoms if the time since ingestion has been greater than 6 hours, and in general, these patients do not need to have a prolonged observation time. Going back to our case, the time since ingestion was 6 hours. She said that her vomiting started approximately 2 hours following the ingestion, and that she took ferrous fumarate, a total of 60 tablets of 300 milligrams each. When you calculate the total elemental iron content of these tablets, it comes to approximately 90 milligrams per kilogram. An ingestion of 40 milligrams per kilogram of elemental iron is used as a threshold for referral to a healthcare facility. In general, ingestions of greater than 60 milligrams per kilogram of elemental iron are associated with severe toxicity. So now we know that our patient has ingested a dangerous amount of elemental iron and is symptomatic at 6 hours post-ingestion. What tests should be ordered for this patient? There are a number of basic lab tests that would be appropriate to order. The white blood cell count and glucose level may be elevated in iron toxicity. Hemoglobin may drop if there is a GI bleed. And electrolytes, anion gap, lactate, and blood gas can help to assess severity. Severe iron toxicity results in a high anion gap metabolic acidosis with a high lactate level. Serum iron concentrations will assess toxicity and guide treatment decisions. Serum iron levels should be measured between 4 to 6 hours to capture a peak serum concentration. But note that a single serum iron level may miss a peak concentration and should ideally be repeated. Iron is an example of a toxin where an X-ray is helpful to guide management decisions. Iron tablets are radiopaque, although liquid iron and chewable iron formulations are typically not radiopaque. Evidence of radiopaque pills on an abdominal X-ray can guide decisions about initiating decontamination, for example with whole bowel irrigation. It can also help to evaluate the success of decontamination with whole bowel irrigation. Here are some follow-up questions. What are the stages, including the signs and symptoms of iron toxicity? What is the antidote for iron toxicity, and when and how is it given? Then, list 3 potential complications of the antidote for iron.